let's focus on the other big news coming in this hour. India has now introduced 4 new vaccines in immunization program.
These new vaccines are for children to fight rotavirus and rubella. Costly injectable polio vaccine also included in this universal immunization program now. There's also an adult vaccine in that list. This is against Japanese encephalitis, especially in those districts with high occurrence of the disease, especially in eastern Uttar Pradesh and Gorakhpur. That's something CNN has been tracking. We've been running a campaign against Japanese encephalitis, which kills hundreds of children every year in parts of Uttar Pradesh. Ramanand Lakshmi Narayan, Public Health Foundation of India, is also somebody who's been very, very active. Dr. R.N. Singh joining us from there, convener of the encephalitis. For now, we'll speak to Mr. Lakshmi Narayan. Mr. Lakshmi Narayan, do you welcome this move by the government?
Absolutely. So the 4 new vaccines are both much needed in the all much needed in the program. 3 of them are aimed at children, and 1 is the Japanese encephalitis vaccine. It's the adult vaccine, which is at an age group that was previously not covered by vaccination. Let me first just say that the rotavirus vaccine is a huge victory for India because there's just this one vaccine alone, which has been developed indigenously in India over the last 25 or 30 years by Indian researchers, will save 50,000 lives of young children as soon as we roll it out throughout the country.
Right. We are also joined by Dr. R.N. Singh, convener of the encephalitis eradication movement. So you have been fighting, against for eradication of encephalitis for a long time. Is this good news? Certainly.
Yes, sir. Definitely very good news, because we are going to save the children of India who are dying because of diarrhea, which is it's not a big problem. But via vaccines, which is being developed now, will save lot many children, which is very good news, and we congratulate for it. It's really something unique.
All right, Mr. Lakshmi Narayan, you spoken about saving 50,000 lives every year, children, of course, afflicted by rotavirus. Does the government have the means and the wherewithal to dispense these vaccines, to make sure that those who need them the most get them as soon as possible?
That's a very good question. While these vaccines are being introduced, there are also significant efforts to increase vaccination coverage. And even at the level at which we're delivering vaccines right now, we will have a significant impact. And so both these are going hand in hand. Now, let me also say that there's also the rubella vaccine, which India has introduced, which gives us a chance to try to wipe out rubella at the same time that we are planning an elimination of measles in this country. And finally, the IPV vaccine, which uses the inactivated polio virus, which once that is introduced, although we're not necessarily going to save any more lives because polio has already been eliminated in the country, will prevent vaccine-derived strains of polio, which now cause some disease. But this will also put us in the trajectory to global eradication, and it's a huge win for India to be part of this. So let me just say, this is probably the biggest improvement in child health and vaccination policy in the last 30 years.
Right.
And this, along with the pentavalent vaccine, these represent enormous steps forward for the country. So it's a time to celebrate and to say that we've really, made decisions and taken steps that will have a lasting impact.
Right. Thank you so much for joining us, gentlemen, on that big story. We continue to track this story. IBNlive.com for more information on that.